This is my aphasia therapy project. The goals include improving recall, problem solving, and organizing information. The project consists of this grid, which contains a list of nouns with their picture and their name written on it, as well as a list of verb labels. They go with these pictures that are of people doing everyday tasks relevant to an adult's life. So I would begin by introducing the topic of memory and how it may be affected by aphasia. We could talk about how their life has changed, instances where they may have been having trouble recalling things or having difficulty problem solving or sequencing, that sort of thing. Once we had discussed that, I would introduce the grid. We could go through together and label each noun as well as each verb. If they were struggling, I may, with the verb, since there aren't pictures, I may have them demonstrate it, or we could look at some other pictures in a book or something so that they had a good grasp of what these verbs look like. Then I would turn over all of these pictures, have them choose one, and turn it over. For example, this is of a woman driving in the car and talking on her cell phone. I would ask them what's happening. They would have to describe the photo using a sentence, hopefully containing a noun and a verb label. So the woman is driving the car, the woman is talking on the phone, she is driving the car, that sort of thing. If they were having trouble with the syntax structure, I may just give them a carrier phrase or phonetically prompt them. Once they had described this picture in a sentence, I would move to asking them about the task. I would ask them to label some things that are necessary to completing it. So for instance, you need keys to drive the car, you need a seatbelt, you need gas, that sort of thing. And the steps necessary to driving. So first you get in the car, then you put the seatbelt on, then you start the car, then you drive, that sort of thing, to work on sequencing. Once we had gone through relevant items and sequential steps of the task, I would ask them to kind of discuss it with me. So some problems that may arise if they are participating in this task and were having a problem remembering something or had forgotten something or became in a difficult situation. So for instance, for the driving picture, after we had labeled the items and the sequences of driving, we could talk about what would happen if you were driving and you forgot where you were going. What would you do in that situation? What could you do to prevent it? Hopefully they would be able to apply these everyday tasks and the problem solving that we would come up with to prevent tasks or to prevent problems in their everyday tasks in their lives. Once we had gone through all of these, I may have, if the client seemed patient and willing to continue, then maybe have them brainstorm some everyday tasks where they have ran into problems, what solutions they came up with, or what they could have done to prevent the problem, that sort of thing. If I had someone that was struggling, I would remove the expressive portion, so just requiring a sentence to describe the photo, and I would add more pictures and action words that were relative to the photos to the grid, so that they had many more visual cues to rely on. And I would also have them just sort the pictures. So, sorting a picture of the car to the picture with the car, sorting a picture of the keys with the car. And then we could maybe sequentially order them, and I may remove the discussion portion, depending on the client. If I had someone that was excelling at this, I would remove the visual cues, so they were relying solely on recall, and we would have just an expressive discussion, almost like a conversation. And if they seem to be struggling a little bit with that, I may just have them write down things so that they could take notes and hopefully bring them home to practice.